Okay, so RBF is a type of funding system where a health care facility or an institution, be it a clinic, a hospital, is paid according to the number of patients that they have treated. And so the hospital is actually, or the institution is actually paid after the act, after rendering a particular service. So this RBF system that we have currently at UBH and the other central hospitals is focusing on maternal and neonatal health. So what it does is they identify those women who are ordinarily unable to go and pay for maternal health, and then they are given a voucher or a coupon which they bring to the hospital. Now, depending on how much, or depending on what we do, the service that we offer to that patient, be it a normal delivery, be it infection after delivery, be it a caesarean section, the hospital will then claim a certain amount depending on what service we actually have offered. So what RBF has done basically is to remove cost or health services fees as a barrier to accessing reproductive health care. That's number one. The idea there is to improve the numbers of women that we see who come for antenatal care. We want to improve the number of women who come and have what we call institutional delivery, which means they deliver in a healthcare facility where they are looked after by a trained somebody that we call a skilled birth attendant. That's number one. Number two, we are also trying to improve the funding of a hospital over and above what the government is doing for all these central hospitals. You also have this additional funding that is coming maybe from a third party to say, okay, you have delivered 70 women under this month under this particular program, so you get such an amount, and that money will then complement what the government and other sources are doing to try and improve reproductive health in the country. And so this money, the principle is that 75% of that money goes towards procurement of the sundries that we need to ensure that the service that we give to the women meets the required standard. The other 25% goes towards members of staff who are directly involved in reproductive health care. So we are now looking at maybe this aspect of motivating the reproductive health workers, motivating our midwives, motivating our gynecologists, motivating all those healthcare workers who are working in maternity. So there are those three advantages that we are looking at: removing the barrier, promoting institutional development, and also motivating the healthcare workers. That's what RBF is trying to achieve. And if we come to UBH was co-opted into the RBF program a bit late. We only started at the beginning of 2022, in January 2022. And we have witnessed an increase in the number of women that we are delivering in a month. Previously, we would deliver an average of around 375 women per month. And following the introduction of RBF in January 2022, we are now delivering upwards of 600 women per month. They have challenges with that, but to us, this means probably that we have had an increase in institutional delivery. We have had a decrease in deliveries at home. Okay. When, like I said earlier on, we've had an increase in the number of deliveries that we're handling at UBH from 375 before the introduction of RBF to the current 600 plus in a given month. Remember, the infrastructure is still more or less the same, so there's going to be a strain on our infrastructure. And then if you look at the our staffing situation, so there are going to be some challenges here and there, but to a large extent UBH has been coping with those challenges.
And maybe what is your message to expectant mothers in making use of this facility, maybe those who may not be in the know about its availability?
Okay, so for every expectant mother, we really encourage, number one, they should book early for antenatal care and antenatal classes. That's number one. Number two, we really encourage institutional deliveries, because it has been proven over and over again that the outcomes are actually much better if a woman delivers in an institution where they are looked after by a skilled birth attendant, compared to delivering alone in the absence of a skilled birth attendant at home. So you want to go to your nearest clinic. If you feel that cost is a barrier for you to access reproductive health care, go to your nearest clinic, find out about how you can get onto this program, so that you access quality health care.